I asked a bunch of different doctors, what's the most misunderstood thing about their specialty? I'll go first. Some patients, and honestly some doctors, treat family medicine doctors like referrologists. But that's furthest from the case. A well-trained family medicine physician can take care of about 90% of medical issues that arise in one's life. The only reason we should be referring to specialists is if a patient has too complex of an issue, multiple ongoing issues that make their specific condition too difficult to handle in primary care, or perhaps that specialists perform a procedure, surgery, or imaging test that we don't have the equipment for.
Hi, I'm Dr. Myro Figura, board-certified anesthesiologist, and that means I put people to sleep for surgery, and even more importantly, I wake them up after surgery. Anesthesia is not an all or none thing. Anesthesia is a spectrum. On one side of the spectrum, you have somebody who is completely awake with a knife in their eye being instrumented on and not minding whatsoever. On another side of the spectrum, deep general anesthesia, you're totally asleep, your heart is stopped, you're not breathing at all. And there's obviously everything in the middle for the right patient, for the right surgery.
Hi, I'm Dr. Danielle Jones. Some of you may know me online as MDJ or Mama Dr. Jones, and I am an obstetrician and gynecologist. One of the most misunderstood things about my specialty is honestly people just being utterly perplexed as to why anyone would want to do this. I'm not kidding, I hear it all the time. People apologizing to me when I'm doing an exam because they can't imagine having this job and they wouldn't want it. But I love this job. I love that I get the opportunity to do this, and I find it endlessly fascinating. I mean, come on. Honestly, I think a lot of it comes from this overarching societal belief that the parts we take care of as gynecologists are somehow taboo or dirty. Nothing about your health or your body is gross or dirty. We have got to get rid of these outdated societal beliefs that cause harm to your health and your ability to access care and feel comfortable doing that.
Hi, I'm Dr. Dana Figura, and I'm a podiatrist, which is a foot and ankle specialist and surgeon. Some people think the only surgery that podiatrists do is ingrown nail removals. And yeah, I take out a lot of ingrown nails. But now all podiatrists are required to do 3 or more years of surgical residency and can correct bunions, foot and ankle fractures, and a few even do more intense things like total ankle replacements.
I'm Dr. Rena, Malik, urologist and pelvic surgeon, and I'm basically a medical and surgical doctor of anything that controls urination as well as sexual function. I think the most misunderstood thing about urology is that we only take care of men. In fact, in urology, we take care of plenty of women. Of course, we take care of women with bladder cancer, kidney cancer, any sort of urologic cancer, but we also take care of a lot of things that are very specific to women. In fact, I did a fellowship called Urogynecology and Reconstructive Pelvic Surgery. And in that fellowship, urologists like me take care of women with pelvic organ prolapse, with urinary leakage, with recurrent urinary tract infections, and with all sorts of reconstructive surgical problems. We also take care of sexual dysfunction, so women who have low libido or low sex drive. Some of us take care of women with menopausal issues. So please go ahead and find a urologist near you if you are struggling with any of these things, or tell your family and friends because we're here to help you.
My name is Dr. Jake Goodman, and I'm a psychiatrist. The most misunderstood thing about psychiatrists is the belief that we just write prescriptions. But good psychiatry is so much more than that. It's about understanding the full person, their biology, trauma, environment, lifestyle. Medication can be part of the solution, but healing goes way beyond a prescription.
My name is Dr. Anthony Youn, and I'm a board-certified plastic surgeon and podcaster. Plastic surgeons are in general perceived as being bougie, rich prima donnas with fake six-packs and expensive race cars. In the case of Dr. Ricky Brown, that may be true.
That's not what most of us do. We're the ones putting faces back together when a person goes through the windshield from a car accident.
Doing hand surgery like replants, or doing breast reconstruction after mastectomy for breast cancer.
In my specialty of breast reconstruction, feeling good in your skin and feeling authentic in your body is really important and very healthy. Having a surgery that helps you think about your body less and how you're living your life more is actually really healthy.
Now, almost every day, patients ask me, why would I choose to be a GI doctor? I just look at butts all day.
We deal not only with the lower half of your gut, but also the upper half of it. Through your mouth, your esophagus, your stomach, your small intestine, and also other organs like the pancreas and the liver.
In a full day of colonoscopies, I spend the vast majority of my time actually just looking at the inside of your colon on a TV screen. And it's in a dark room, so we can't even get that good of a look at your butt, so there's no need to be self-conscious.
Hi, I'm Ed Home. I'm a resident doctor in the UK working in emergency medicine. When we're not physically seeing the patient, we have so much admin to do, and TV shows gives us the impression that emergency doctors are bouncing from one cardiac arrest to another. Reality is, for every minute we're seeing the patient, we probably spend around 5 times that ordering and reviewing tests, prescribing treatment, getting advice from colleagues, and typing our notes. And this can often be perceived like we aren't doing anything for the patient, but a lot is happening on your behalf away from the waiting room.
I'm Dr. Gary Linkov, double board certified in otolaryngology and facial plastic surgery. People think that hair transplant surgery is purely technical, but it's not. It's an art. Creating a natural looking result takes an artistic eye for hair density, design, and flow. It's not about just moving hairs around, it's about making it look like they were always there.
Hi, I'm Dr. Antonio Webb. I'm an orthopedic spine surgeon. So people always assume that spine surgeons always jump to surgery, and that's not true. In fact, most patients that see me in office don't need surgery. We try to focus on education, therapy, lifestyle changes, and these are the first line forms of treatments that we try to take.
My name is Dr. Alok Patel. I'm a board certified pediatrician and I work in pediatric hospital medicine, best specialty ever. People say that pediatricians don't care about prevention. We just push medications, treatments, and pills. That could not be further from the truth. We spend so much time counseling patients and families about lifestyle interventions, diet, exercise, injury prevention, ways to prevent infections such as with vaccines. We put our heart and soul in it to keep kids out of the hospital. And this extends beyond patient education and includes our work with public health agencies, advocating, lobbying, and so much more, because prevention is everything in pediatrics.
I'm Dr. Abby Waldman. I'm a dermatologist and I specialize in skin cancer surgery. Big misunderstanding about dermatology is thinking it's only skincare and cosmetics. We actually treat a wide range of diseases, including autoimmune disease, skin cancer, and really severe skin rashes.
Greetings, well-beings. I'm Dr. Schehrezeade Khan, and I'm an internal medicine specialist. That means I take care of your internal organs, keep them happy and healthy so that you don't have to see a specialist. The most misunderstood thing about my field is that people think you need to go to an internal medicine doctor for a cough or a cold, when in reality, we are treating the leading causes of death. We're actually preventing them. Internal medicine doctors are at the forefront of prevention. Heart disease alone kills more people than all the cancers combined. And while most people are worried about Alzheimer's and cancer, the leading causes of death are heart attack, stroke, and diabetes.
Other people think that preventive medicine is just about telling you to eat better and move more, which is part of what we do. But it's actually about creating systems and tools for preventing disease. We're talking about public health, policy, lifestyle, optimizing electronic health records, research, and many other things.
I think pretty much everything about rheumatology is misunderstood. Like, what is a rheumatologist anyway? Our specialty got its name back in the 1940s, when rheumatism was a term for non-specific joint pain. Over the years, we've discovered that the root cause of these symptoms is often autoimmune diseases, meaning your immune system is attacking your body. So we're not just focused on the joints anymore. I actually think of myself more as a specialist in suppressing the immune system to keep those diseases in check. Maybe it's time for rheumatology to have a bit of a rebrand.
I'm Eric Topol. I'm a cardiologist. So many people think that women don't have such a substantial risk of ischemic heart disease. But in fact, that's the #1 cause of death in women. And especially we should be in tune with postmenopausal women, because the risk of coronary disease is equivalent to that of men.
My name is Dr. Hanzy Bustamante. My specialty is internal medicine and I work as a hospitalist. I really feel that patients and their families don't understand that the big chunk of care that we provide happens when we're not at the bedside. Hospitalists like myself spend a lot of time consulting with specialists, talking to radiology, case management, and social work. We also make sure that patients' hospital stay is in compliance with insurance and government rules.
Do you know why cat bites are so dangerous? Click here to find out, and as always, stay happy and healthy.